Welcome back to Jamyy English. I'm Jays.
And I'm Amy. Episode 24, April 24th.
And today, we're not feeling well.
Which is never a good time, but it's a much better time if you have the English to get the help you need.
The doctor, the pharmacy, the clinic, the situations nobody plans for but everyone encounters. And when they happen, you need your English to work clearly, calmly, accurately.
I remember my first experience visiting a doctor in English. I was in London for a work project. I had a bad chest infection, and I had to call a clinic to make an appointment. I had my notes written out in front of me. My heart was racing more than my chest hurt.
What happened?
The receptionist was so calm and clear. She asked simple questions: name, date of birth, what the problem was, and my notes had everything. I got through it fine, but the preparation made all the difference.
Preparation. That's this episode. We prepare you now so that when you need it, you already have it.
Let's go.
Step 1. Making a medical appointment, whether by phone or in person.
By phone, which is the most common way in the UK and US, you call, someone answers. Good morning, City Health Clinic, how can I help? And you say, hello, I'd like to make an appointment with a doctor, please.
Simple and direct. I'd like to make an appointment. That phrase works for any type of appointment. Doctor, dentist, specialist, optician.
The last, is this urgent or routine? Urgent means you need to be seen soon, today or tomorrow. Routine means a general check, not pressing. It's fairly urgent. I've had a chest infection for 3 days. Or, it's routine. I just need a checkup.
Checkup. A general health examination with no specific problem. I'd like to book a checkup.
They'll ask for your name, date of birth, and sometimes your symptoms briefly. What seems to be the problem? Just a sentence or two. I have a fever, a sore throat, and I'm struggling to breathe properly.
Struggling to breathe. Experiencing difficulty with breathing. Properly means normally, as you should. I can't breathe properly is slightly urgent. Say it if it's true.
The law for a time. We can fit you in at 3 tomorrow afternoon. Fit you in. Find space in the schedule for you. Sometimes also, we're quite booked. The earliest we have is Thursday. Is that okay?
That works, thank you. Or, is there anything sooner? I'm quite uncomfortable. Expressing urgency without panic.
Confirming. So that's Wednesday at 11 with Dr. Williams. Could you remind me of the address? Confirm the key details and ask for anything you need. At the clinic. Arriving, registering, waiting.
In the UK, you'll typically register as a patient the first time. I'm not registered here. I'm a new patient. New patient, first time at this clinic.
In the US, you may have insurance to deal with. I have insurance, here's my card. Or, I don't have insurance, what are the self-pay options? Self-pay means paying directly without insurance coverage.
You'll fill in a form: medical history, allergies, current medications. Medication, medicine you take regularly. I'm on blood pressure medication. On medication means regularly taking it.
Allergy, a harmful reaction to a substance. I'm allergic to penicillin. I have no known allergies. No known allergies is the standard phrase when you don't have any.
Then you wait. The doctor will be with you shortly. Shortly means in a short time, not necessarily immediately, but soon. Take a seat and wait to be called.
The doctor will see you now. You're being called in. Follow the nurse or receptionist.
With the doctor, this is the most important part, the consultation.
The doctor will introduce themselves and say, so what brings you in today? Or what seems to be the problem? These both mean, tell me why you're here.
Your answer should be clear and structured. Start with the main symptom, then add details. When it started, how bad it is, anything that makes it better or worse.
I've had a really sore throat for 4 days. It started as a mild irritation, but it's gotten progressively worse. It's painful to swallow, and I've been running a low fever.
Let's unpack that. Progressively worse, getting worse over time, step by step. Painful to swallow, swallowing causes pain. Running a low fever, having a mild fever that comes and goes.
Other key symptom descriptions. I have a persistent cough. Persistent, lasting, not going away. I've been having headaches for about a week. My stomach has been cramping on and off, intermittently, not constantly.
I feel run down. Run down, depleted, lacking energy, weak overall. Not specifically ill, just everything at low capacity.
I can't seem to shake it. Can't shake it, can't get rid of it, despite time passing. I've had this cold for 2 weeks and I just can't seem to shake it.
Location of pain. It's here and point. Or describe. I have pain in my lower back. My right knee is swollen, enlarged, inflamed.
The doctor will ask follow-up questions. On a scale of 1 to 10, how bad is the pain? Have you had this before? Are you on any medications? Any allergies?
Answer each clearly. About a 6. I had something similar last year, but it resolved itself. I take vitamin D daily, but nothing else. Penicillin.
If you don't understand what the doctor says, ask, "I'm sorry, could you explain that in simpler terms?" Doctors use medical terminology. Asking for simpler language is completely normal. What does that mean exactly? Is that something to worry about?
Could you write that down for me? Asking them to write the diagnosis or prescription details. Very practical. You'll need the correct spelling for the pharmacy.
And at the end, what should I look out for? When should I come back if it doesn't improve? These questions show you're engaged and they give you important information.
Should I be concerned about asking about something specific that's worrying you? Should I be concerned about the fever coming back? Direct and appropriate.
Common diagnoses, what you might hear and what they mean.
It looks like a viral infection. Viral, caused by a virus, not bacteria. Antibiotics don't treat viruses. It should clear up on its own in a week or 2.
I'm going to prescribe you some antibiotics. Antibiotics, medicine that kills bacteria. Prescription, the doctor's written authorization for specific medication. Take the full course even if you feel better. Full course, all the medication, not just until you feel better.
You have a mild case of... Mild means not severe. This is quite common and nothing to worry about. Reassuring language from a doctor.
I'd like to run some tests. Tests, blood tests, urine tests, scans. I'm going to refer you to a specialist. Refer, send you to an expert for a more specific problem. Specialist, a doctor who focuses on one area.
Get some rest, stay hydrated, and take paracetamol for the fever. Hydrated, drinking enough water. Paracetamol, common painkiller used in the UK. Acetaminophen in the US, same medicine, different name. Let's do a role play. Amy is seeing a doctor for the first time in a new country.
Good morning. I'm sorry to come in. I tried to manage it at home, but I think I need to see someone.
Please don't apologize. That's what we're here for. So what's been going on?
I've had a really bad cough for about 10 days. It started as a normal cold, but the cough won't clear up. I'm bringing up a lot of mucus, and I've been waking up at night with coughing fits.
Okay. Any fever? Chest pain?
I had a low fever for the first few days, but that seems to have gone. And my chest feels like uptight sometimes. Not painful, just heavy.
Any shortness of breath?
When I'm walking fast or climbing stairs, yes, more than usual.
Right. I'm going to listen to your chest. Can you take some deep breaths for me?
Of course.
Okay. So your chest is a bit rattly, which suggests there may be some infection in the lower airways. I'd like to send off a sputum sample to check if there's bacteria involved. And in the meantime, I'll give you a course of antibiotics and a short course of steroids to help reduce the inflammation.
I'm sorry, a sputum sample?
Saliva, the phlegm you're bringing up when you cough. We'll test it to see what's growing.
Understood. And the steroids, are those safe to take with anything else? I'm on the pill.
Yes, that's absolutely fine. The course is 5 days. Take them in the morning with food. Any side effects should be mild, mainly maybe some disrupted sleep or increased appetite.
Thank you. And if it doesn't improve?
Come back in 5 days. If your symptoms are getting worse before then, especially if you're struggling to breathe, come back sooner or go to A&E. A&E is accident and emergency, like ER in the US.
Thank you so much. I really appreciate it.
That's what we're here for. Take care.
Let's look at the language. I tried to manage it at home, but I think I need to see someone. Very British phrasing. People often delay seeing a doctor and then apologize for coming. Don't apologize. Come when you need to.
Coughing fits. Intense, uncontrolled coughing episodes. Fits is used for sudden, intense episodes of many things. Laughing fits, sneezing fits.
A bit tight. Describes pressure or constriction. My chest feels tight. Not painful, but something.
A bit rattly. The doctor's description of an unusual sound in the chest. Rattly means making a rattling sound. Informal, but used by doctors in consultation.
I asked a clarification question mid-consultation. I'm sorry, a sputum sample? This is exactly what you should do. Confirm any word you don't understand.
And am I on the pill? I asked about a medication by its common name. The pill is the common term for oral contraceptive in British and American English. Doctors understand all common names. Let me add something about mental health and going to see someone for emotional rather than physical reasons. Because in English-speaking cultures, this has become much more normalized, and the language around it is important to know.
Yes,
Seeking help for mental health used to carry stigma. That's changing, and the vocabulary around it is increasingly part of everyday English.
I've been seeing a therapist. A trained professional who helps with mental and emotional health. Seeing in this context means regularly attending appointments with.
I've been talking to someone. Informal for seeing a therapist or counselor. I've been talking to someone about it. It's been really helpful.
Counselor, a mental health support professional, often in a school, workplace, or community setting. Psychiatrist, a medical doctor who specializes in mental health and can prescribe medication. Psychologist, a mental health specialist without prescribing ability in most countries.
I've been referred to a psychiatrist. Your GP, general practitioner, the standard doctor, has sent you to a specialist.
Common phrases around mental health. I've been struggling. Struggling means finding things very difficult. Deliberately not specific. It leaves the conversation open. I've been struggling lately and I decided to do something about it.
I needed to talk to someone. I've been feeling overwhelmed and it was getting to be too much. Getting to be too much, reaching a threshold where you couldn't manage alone.
I'm working on it. I'm actively addressing something. I know I have anxiety. I'm working on it. Accepting and active at the same time.
How to respond when someone tells you they're seeing a therapist or seeking mental health support. The right response. That's really brave. I hope it helps. Or, good for you. That takes real strength. Acknowledging the courage without making it strange.
What not to say? You don't seem like you need it. Isn't that a bit extreme? Can't you just talk to friends? These responses, however well-meaning, undermine the person's decision.
In English-speaking cultures, increasingly, going to therapy is seen like going to the gym. You do it to stay well and to grow, not only when something is severely wrong.
I find it really helpful to talk things through with someone neutral. Neutral, not personally involved. The value of a professional is precisely that they have no stake in your relationships or decisions.
And if someone asks how therapy is going, the polite response to offer is brief. It's going well, thank you. Or, it's been really useful. You're not obligated to share details. I'd rather keep that private if you don't mind, is always appropriate.
Your health, physical and mental, is your own. You share what you choose. The language we've given you today lets you get the help you need in English on your terms. At the pharmacy. After your appointment, you have a prescription. What happens next?
In the UK, you take your prescription to a pharmacy, also called a chemist. I'd like to fill this prescription, please. Fill means have the medication dispensed. Take the paper and get the actual medicine.
In the US, pharmacies are often inside large shops, CVS, Walgreens. I'd like to drop off a prescription. Drop off means hand it in to be processed. It may take time. It'll be ready in about 20 minutes.
Over-the-counter medication, medicine you can buy without a prescription. Do you have anything for a persistent cough? What would you recommend for a sore throat? The pharmacist, a trained professional, can advise.
Is this non-drowsy? Will it make me sleepy? Important if you need to drive or work. I need something I can take during the day. Daytime formula, specifically for daytime use, non-sedating.
Reading the label. Take 2 tablets twice daily with food. Tablets, solid medicine. Twice daily, 2 times per day. With food, eat something before or with the medication.
Do not exceed the recommended dose. Exceed, go over, take more than. Don't take more than the packet says. Do not take on an empty stomach. Empty stomach before eating.
Asking the pharmacist, is this safe to take with paracetamol? Checking for drug interactions. Interactions when 2 medicines affect each other negatively. Always ask if you're taking more than 1 medicine.
How long before I notice it working? A practical question. Usually within 48 hours for this type, or you should start feeling better by day 3.
And complete the course. Take all the medication even if you feel better before it runs out. Especially important for antibiotics. Stopping early can cause the infection to return, stronger. Useful phrases for health conversations in general.
I've been under the weather. Feeling slightly unwell. Not serious, just off. I've been a bit under the weather this week.
I'm coming down with something. Starting to feel ill. I think I'm coming down with a cold. Coming down with means beginning to develop an illness.
I think I'm on the mend, getting better. On the mend, recovering, improving. I was quite bad on Wednesday, but I think I'm on the mend now.
I need to take it easy. Rest, not overdo things. Doctor said to take it easy for a few days. I'm going to take it easy this weekend. Take it easy, reduce activity, rest more.
I've been run ragged, exhausted from overwork or illness. More intense than run down. I've been run ragged this week. I need to slow down.
I need to look after myself. Take care of my health. British expression for self-care. I've been neglecting my health and I need to look after myself.
And the essential phrase when someone you know is ill, is there anything I can do? Offering help without being specific. They can tell you what they need. Just let me know if there's anything I can do.
One more thing I want to cover, describing symptoms accurately to a non-medical person, because sometimes you're explaining how you feel to a friend, a colleague, or a family member, not a doctor, and that conversation has a different tone.
Right. I've been experiencing acute pharyngitis, is what you might write on a form. I feel absolutely terrible. My throat is like sandpaper, is what you'd say to a friend.
Like sandpaper, very rough and scratchy. A great physical metaphor that immediately communicates the sensation.
Other body-feeling metaphors. My head is pounding. Pounding, a heavy rhythmic pain, like something repeatedly hitting from inside. I feel like I've been hit by a bus, run over, flattened, total body exhaustion. Hyperbolic, but universally understood.
My legs feel like lead, heavy, difficult to move. I can barely lift my head off the pillow. Extremely weak, gravity-bound.
I feel queasy. Queasy, slightly nauseous, like the world is shifting slightly. Not full nausea, just that unsettled, tilting feeling.
I'm burning up, having a high fever. Your body feels very hot. I was burning up last night. I couldn't get comfortable.
My whole body aches. Muscular pain throughout. Classic flu symptom. Everything hurts. Even my skin feels sore. That last one, skin sensitivity during illness, is surprisingly common with fever.
These vivid physical descriptions help the listener understand immediately. They put the listener inside your experience, which is what good description does in any context.
And the response when someone is describing their symptoms? That sounds miserable. Miserable. Deeply unpleasant. A warm, empathetic response. Not medical advice, just acknowledgement.
You poor thing. British expression of sympathy. You poor thing. How long have you felt like this? Genuine care.
Is there anything I can bring you? Practical love. Food, medicine, company. Do you need anything?
These responses, that sounds miserable, you poor thing, what do you need? These are the sounds of someone being cared for in English. Learn them, give them, and let yourself receive them too.
Lightning round. Medical English.
Ready.
You want to make an appointment.
Hello, I'd like to make an appointment, please. It's fairly urgent. I've had a fever and sore throat for 4 days.
You don't understand the doctor's terminology.
I'm sorry, could you explain that in simpler terms? I want to make sure I understand.
The pharmacist asks if you're on any other medication.
I take a daily vitamin and I'm on the pill. Is that okay with this?
You're getting better after being ill.
I think I'm on the mend. I feel a bit more like myself today.
You want to warn a colleague you're not well.
Just so you know, I think I'm coming down with something. I'll try not to pass it on.
The doctor tells you to take it easy.
I'll take it easy this week and come back if it gets worse, I promise.
Perfect. Every time.
Homework. Look up the nearest walk-in clinic or pharmacy in your area or in an English-speaking city you might visit. Note the address and the opening hours. Just having that information ready means one less thing to figure out when you're feeling terrible.
And practice out loud. I've had a sore throat for 3 days and I've been running a low fever. I'm not on any medication and I have no known allergies. Say it until it feels natural. Your future self will thank you.
In the comments, tell us, are you good at looking after yourself when you're ill? Or are you the type who says, I'm fine, until you're not fine at all?
Tomorrow, episode 25. And we hope you're not there yet, but if you ever are, emergency situations. What to say when things go seriously wrong.
See you tomorrow.
Let's learn, speak, and grow together. See you tomorrow.